It is time for our house call with Dr. Andy, and with all the news about Heath Ledger's death, we know there were prescription anxiety medications and sleep medications with him. So a lot of people have had questions, especially like even people on our staff who take the Tylenol PM or something.
Right.
How easy is it to overdose on these medications, and what do we need to know about sleep aids?
Well, the good news is it's very difficult to overdose on most sleep aid medications, including Benadryl, for example, which isn't Tylenol PM. You can take too much of it, and it can cause a problem. But for the most part, these drugs are fairly safe. But with that said, insomnia is a huge problem. In a recent survey, up to 1/3, and this is a huge number, up to 1/3 of adult Americans consider insomnia a chronic problem for them.
Well, we get so busy with our daily lives, we're running, it's hard to slow down. And sometimes
Work,
you think,
kids.
yeah, I got so much stuff to do, I can't sleep, but your body will collapse and you need that rest.
And well, the good news is there is treatment. There are things you can do about it. There's some very effective treatments. The bad news is the non-drug treatments are just as effective, but they take more time on the part of the doctor to talk with the patient.
Okay.
Which, sitting in someone's living room, I have the luxury of doing so, but many of my colleagues don't. And in the part of the patient, it takes a little more work to implement that. So a lot of people end up taking drugs to help them sleep.
What are the dangers? What are the warning signs? Can you become, like we see commercials all the time for Ambien CR, Lunesta, Sonata. Can you become addicted to these drugs? If I accidentally take 2 pills, am I going to die? If I mix it with other drugs, will I die?
Well, you should mix it with alcohol, first of all. That's worth saying. There is a warning label that was just put out by the FDA that use of alcohol with any sleep aids can lead to restlessness and strange sleep behaviors like sleepwalking, or people have said they do things like talk on the phone or get behind the wheel of the car and don't remember it. So don't drink with any of these drugs. But with that said, some of the new ones like Ambien CR, Sonata, Lunesta, Rosarum, for example, all are now saying that they can be used for long periods of time without the risk of a dependency.
Okay.
There's a caveat to that. All those studies were done for about 6 months. So there is no one that can say that these don't cause dependency. So the government actually tells us there is a risk of dependency with any long-term use.
What about mixing like a Tylenol PM or an over-the-counter medication with your normal medications? Do you need to check with your doctor? Can there be adverse effects from that?
Definitely check with your doctor. Benadryl specifically is a fairly safe drug, but taking too much, it can make you drowsy, and it could make you go to sleep for a long time, and if you mix it with the wrong drug, it can be dangerous. It can also raise blood pressure.
We certainly don't want that.
And those aren't as dangerous as the drugs that we think Heath Ledger may have been on, called benzodiazepines, and those can actually be addictive. They can be very sedating, which is why they're used for sleep, and they can also cause confusion in the elderly and falls.
So the best word of advice is talk to your doctor if you're on any type of anxiety or sleep drug, and don't mix.
And definitely talk to your doctor, period, if you have problems sleeping, because there are treatments out there.
You definitely want that. You need the good night rest. If you have more questions, you can always shoot Dr. Andy an email or give him a buzz, 694-6246, Dr. AOL at phc-md.com. Dr. Andy, thanks for stopping by. See you next week.